My name's Neil Fenn. I'm a consultant urological surgeon at Swansea Bay University Health Board and HMT Sancta Maria Hospital in Swansea. I have a specialist interest in uro-oncology, mainly prostate and kidney cancer. If you are diagnosed with a prostate cancer, there are a number of different treatment options which essentially go from doing nothing, which we often term surveillance or watchful waiting, all the way through to radiotherapy, surgery and oncological treatments. We would tailor your treatment to your individual case. So that would include an assessment of your age, your other medical problems, as well as specific factors related to the cancer itself, the aggressiveness from the biopsy, as well as the results of the staging investigations. What is important is we mentioned surveillance or watchful waiting is often utilised, particularly in elderly men with low volume, low grade prostate cancers that are unlikely to cause them any problems. So it's just a case of watching and reviewing these patients. So for those localized cancer cases we feel are not suitable for surveillance or watchful waiting, then we would discuss radical treatment options. There are a variety of different options that are available, some of them locally and others that you would need to go further afield for. As it currently stands, we tend to discuss radiotherapy treatment, and that can either be external beam radiotherapy, and that will be given at the Singleton Hospital. We can use the implantation of some seeds that deliver their radiotherapy internally, and that's called brachytherapy. And then of course there's surgery. Surgery essentially involves the removal of the prostate gland and then some surgery to join your bladder and your urethra back together. Surgery has evolved over the last 20 years, which is initially that was open surgery, and that progressed on to laparoscopic or keyhole surgery, and now we offer robotically assisted laparoscopic radical prostatectomy, which is the latest and most up-to-date surgical treatment for the prostate gland. So if the prostate cancer has started to progress and is starting to push out of the prostate, then in this situation we would discuss the use of external beam radiotherapy, but quite commonly we would also add in some hormone treatment, and really this is a treatment to temporarily reduce the testosterone levels in your body, and that will be started 3 months ahead of you having the radiotherapy. It's been shown that that combination of treatments is better than the radiotherapy on its own in this situation. Unfortunately, a number of patients after their diagnosis and staging will actually be shown to have disease which is already spread from the prostate and to other areas within the body, mainly lymph glands and the bones of the body, and this is called metastatic disease. Again, we're very fortunate there's been an explosion in the different types of treatment that are available for this stage of disease, and this has allowed many patients to have long-term survival despite the advanced disease at presentation. These treatments are all provided by the oncology department, by oncologists, and you would be referred on for consideration of these. So if you're on a surveillance or a watchful waiting program, or you've had radical treatment, you will obviously be followed up after the active treatment. This is generally, initial follow-up is to ensure that the complications of treatment are managed, but then also to follow up whether Many patients who are diagnosed with prostate cancer have very early localized disease. They may have other medical problems, and they may be elderly. In this group of patients, we often use a treatment option which is called watchful waiting. This is just merely keeping an eye on disease. It's often very indolent, the disease, very slow growing, and is unlikely to affect the patient's life expectancy. So it's important to remember that not all patients with prostate cancer are going to require active treatment, and that they can live with their prostate cancer a completely normal life. So having the diagnosis of prostate cancer can often be very daunting, although your consultant urologist will provide you with both verbal and written information. By the time you've got home, you may wish that you require further information. I would direct you to a number of different websites. Prostate Cymru, which is an all Wales prostate cancer charity in which clinicians are actively involved, certainly can provide you with the information you require. And then if you require more detailed information, you may wish to look at Prostate Cancer UK, which again is an organisation in which there's active clinical clinician participation and provide you with good quality information.